Hey everybody, Karen Anderson here with Aortic Hope for this week's Week in Review. Before I even start, I'm going to give a quick shout out to Molly and Velda. Hello, hello. All right, everybody else, Week in Review. It is a recap of what we have put on our social media pages. So if you're not on social media, if you're not on Facebook, this is where you have an opportunity to learn a little bit about what we have been sharing in the community. These are posts from our medical students. They are posts created by some very talented social media administrators on our team. And it kind of gives you guys a chance to interact with me, share your opinion with the community, and just learn, and hopefully click share at the end of this. So before we get started, click like, click the bell under subscribe. We have to click subscribe, but click the bell so that you're notified every time we go live. Like tonight, we're going live tonight at 7:30 with Amy Wagner. She is a LCSWC, that is a licensed clinical social worker with an extra special certification at the end. And she kind of specializes in trauma and health related trauma. And May is Mental Health Awareness Month. So that's why we're bringing her on to kind of talk to us a little bit about what happens in our brains, which is as important as our aorta. What happens to us when we have an emergency like an aortic dissection, or you have a diagnosis like you have an aneurysm and it's fairly large and you might need to have surgery. What happens to us? What happens to the caregivers? What is PTSD? What are some of the signs and symptoms in some ways that you can alleviate that? And in general, how can we have better mental health? So really looking forward to that this evening. We have a couple different things happening this week. Bless you. I think I heard a sneeze. We have a couple different things happening this week, including, bless you again. Um, Including we've got aortic artists this week. We have a live event with Dr. Hajar. She's, I believe she's a cardiologist. I'm pretty sure she could be a surgeon, and I just can't remember because I'm still coming back off of vacation mode. Out of Canada, so we're so excited. She leads Lowy Dietz Foundation out of Canada, so we're super excited to be able to interview her. My co-host for the night will be Velda McKenzie, who runs our Aortic Hope Canadian page. I'm going to kind of let her take the reins a little bit. So she's listening now. You should be preparing with some great questions when I hand it off to you. So that's the whole point. Hit the bell. You'll be notified when these events happen. We look forward to having you there. And then at the end of it all, please share. Please consider sharing because you will help somebody else find our organization and become educated with some accurate information. So let's kick this off with our Movement for Movement Monday post. Way back in the past, seems so long ago, right before COVID hit, we started a movement for movement. What we were finding is a lot of people were becoming cardiac paralyzed almost, and they were just scared to move, and rightfully so. We don't know what's happened to our bodies if we've had emergency surgery. We don't know what could happen to our bodies if we find out we have an aneurysm or our valves are failing. And sometimes we're scared we're just going to implode. It makes perfect sense. It's completely normal until you become educated. And then sometimes we need a little bit of motivation to get us moving. So this is our Monday check-in from Joyce. And we kind of encouraging everybody to up their steps. If you're upping your steps, you are uplifting your spirit. They kind of go hand in hand. Every single step counts. And whether it's a few extra steps in a day that you're taking around the house, you're going for a short walk, whether it's to the mailbox, a short little stroll in the sunshine, movement adds up. And of course, remember, do whatever it is your doctor tells you you're okay to do. Look, we recognize doing nothing is doing something, and sometimes just getting out of bed. That's like a massive win, and you want to take that win, right? But other days, you might actually surprise yourself with how far you're able to go. And the goal isn't perfection. The goal isn't a marathon or a triathlon. It's just progress, continued forward motion and progress. And it's showing up for your body and honoring the strength that you actually do have and recognizing what you can do. And again, even if it's doing nothing, that's okay for that day. And even if it looks a little different, honor that, revel in it, right? Especially after surgery. I mean, sometimes just excuse me, putting your shoes on is exhausting. Hey, but that's movement in and itself, right? So this spring slash almost summer, we want you to challenge yourself. We want you to just take a few more steps, just a few more, right, than you did yesterday. And that might mean parking a little bit farther away, go down an extra row, right? And take an extra steps to get into the store. Don't do it for anyone else. Don't do it for numbers. Don't pace yourself as far as time yourself. And I've got to get this mile in 15 minutes. Do it for your heart. Do it for yourself. Do it for healing. Do it for hope. Those are your purposes, right? And you don't have to do it all at once. You don't have to even move fast. So just keep walking. It's kind of like Dory from Finding Nemo. Just keep swimming, right? Just keep walking. Okay. Your strength is meeting you where you are, and always check in with your doctor before you start something, any new exercise, and don't discount how your medications might impact your body, especially in heat. Okay, and we'll say the same thing when it's wintertime, especially in the cold. So you want to make sure you're well hydrated, etc. um, Tell us how you're challenging yourself. You'll find these posts on Facebook, you'll find them on our website. Check it out and tell us how you're doing. I always amaze myself when I realize sometimes at the end of the day just how much I've done, especially when I think I can't do it and I'm able to do it. That's the good day. That's the win. But then again, it's also a win when I know I'm exhausted and I wake up and I've taken a beautiful 3-hour nap. So that's a win. I take the wins, right?
I like
So,
it.
Josh,
Constantly
yeah,
winning.
constantly winning. I can be a continuous winner if I want to.
Hi, Molly, Velda, and Christina.
Hi,
Molly.
Christina.
Molly says, I can't wait to watch your show tomorrow. Yay, Velda.
So exciting. I love
I
this for
know.
Velda. I love
Molly,
it for the Canadians.
Molly, I do have a headshot of the lady. We'll have that thumbnail ready for you later today.
Yep. So exciting. I will get that event actually up when I hang up. When we're done this, that event will go up. I've been falling
Some
behind
gaps. Some gaps.
tiny bit. When you take a vacation and you got so much going on and you think you nailed it and you realize, no, I kind of screwed up 3 times. You just take it. You just said,
Hey,
yep, I own it.
Katie has joined the chat. Hey, Katie.
Hey, Katie. But you know what? Is there screwing up when it comes to volunteering? And the answer is, yeah, there is. There still is.
You know
Accountability.
there is.
I know there is, but I got to take the lumps. All right, we're moving on to Topic Tuesday because I love Topic Tuesday. Hey, but this was perhaps so I don't have to worry about it being necessarily extremely long, hard to pronounce words because that's when Cy does his posts. Woo, they nail me. They get me. All right. Topic Tuesday. This particular Tuesday, which was last week, we are going to talk about what is one of his favorite segments, and that is the aortic root. It's probably all of your favorite segments, those of you who have had ascending dissections or you have aneurysms, because the root can or may not be involved. The same thing when it comes to aortic valve disease, it may or may not be involved. So it's important. Again, aorta, largest artery of the body. We will keep telling you this for eternity. But the very first part of the aorta, which is zone like 0, 1, okay, because it's right there. Is where the aortic root is. That's right where it comes out of the heart. That's like as the beginning can be. And it's very short. This section's actually very short. It's only about 3 centimeters in length. So we're not talking a long area for that zone, but it's a very intricate structure, okay, with some very important functions. So let's get right into it. Here it is. Here we are. We are in that root, right? We're right here. This is how funky it looks. A lot of different areas. You've got because this is part of your valve. Okay, so here's a leaflet. That would also be a leaflet too. And then there would be a third leaflet, unless you're born with a congenital heart defect. And that would mean if you only had 2 leaflets, what's that mean? What kind of valve do you have? Bicuspid. 2 bicuspid. If you only have one of these leaflets and it's just kind of opening and closing like a door, that's an uno, I think. Mono, no, uno cusp, right? If you have 4, which is crazy, it's a quadcuspid. And there's so many different types that people have, although the trileaflet would be the preferred, but the most common of the defects would be bicuspid, okay? Sinotubular junction. See here, you can see this is the complete looking at the valve down. You have the sinotubular junction, which is right where that valve meets up into the aorta. I'm not too sure what a commissure is, but it sounds very French, even though it's probably Latin. This is the sinus of Valsalva. This is the area in the leaflets. You have your leaflet attachment right here. Interleaflet triangle, because it's a triangle. I'm not a doctor. I'm just reading what's on the screen. And a ventriculo-aortic junction. Never heard of that one. That one's a new one for me. But there's three main components we really want you to be aware of when it comes to the aortic root. So as we already just discussed, the first one is the aortic valve. Very important area in the root. And the aortic valve actually is what separates the left ventricle. Remember, we talked about the atrium is the top sections, the top two chambers of the heart, and then you have your ventricle, which is lower. So on the left side, you have your left ventricle, and the valve is what separates the left ventricle. The left ventricle is what is bringing in all of the oxygenated blood and pumps it out through the aortic valve up and out of the aorta down to the rest of the body. So this separates, so the aortic valve separates the left ventricle, which is part of the heart, from the aortic root, and the valve and the root are intimately related. And the annulus of the valve, which is where the leaflets actually attach to the walls, provides stability to the base of the root. And if the annulus weakens, right, this area that provides stability, if it becomes weak, the root can actually stretch and form this thin aneurysm with the risk of dissection or rupture. And malfunctioning valves could be ones that have stenosis or ones that have regurgitation, they're just not functioning properly, can create turbulent flows that may contribute to aneurysm formation. So meaning it would not necessarily be uncommon if you had an aortic valve that's regurgitating and you also had an enlarged area right at the root or in the sinus of Valsalva. The sinuses of Valsalva. So these are three small outpouchings or pockets located just above the aortic valve. And there's one for each of the leaflets. And they house the origins of the coronary arteries. And these are specific arteries that feed blood to the heart. And specifically, the left side, the left coronary artery comes off the left sinus, and the right coronary artery comes off the right sinus. And the remaining sinus is called the non-coronary sinus. The balloon-like shape of these sinuses actually allow blood to flow smoothly, and they help the valve close efficiently. It does not mean if your valve is leaking and not closing that you have some major thing wrong with a coronary. Doesn't necessarily, they don't correlate together. Okay, so don't jump to a conclusion, oh, I have a regurgitating valve, I must have coronary artery disease. I don't believe that the two go hand in hand. But if you have that question, you should ask your doctor. All right, the third area is the sinotubular junction. And this is the point where the aortic root transitions into the ascending aorta. And here the sinuses kind of come together and they form a cylinder. And many times aneurysms in the root are continuous with aneurysms in the ascending aorta. So if you have one in the root, you probably got one that's also moving into that ascending aorta portion. Dissections in the aortic root are particularly very dangerous. I mean, that's going to be your highest point of blood flow because you're literally attached to the heart. The dissection could actually distort the aortic valve and cause sudden aortic regurgitation. And that can actually be life-threatening because you have this massive amount of blood flow that's going back into the heart chamber. It's not supposed to do that. And the dissection can also extend towards the heart and cause the blood to surround and compress the heart within its sac. And that's a phenomenon called pericardial tamponade. And you might have heard these words or read them in your medical records. And this is what it's referring to when blood kind of surrounds and compacts the heart. The dissection can also involve the coronary arteries, which then causes poor blood flow, resulting in large myocardial infarction, which is another word for a heart attack. Okay, so when the coronaries are involved, poor blood flow equals heart attack. Okay, so if you hear MI, that's your abbreviation for myocardial infarction, and it basically means heart attack. The management of aortic root aneurysms involves, just like every other one, it involves careful monitoring. You really want to make sure there isn't growth and it's not fast growth, and there will be a surgical repair at certain point. And it usually involves something called a Bentel procedure or valve sparing root replacement, or you might have heard VSR. Bentel, you've probably heard Bentel because we hear about the Ross procedure. This is the Bentel procedure, and it would involve replacing the aortic valve and the root, all right there. re-implanting the coronary arteries onto the new aortic roots. So this valve-sparing root replacement preserves the aortic valve and replaces the aneurysmal, aneurysmal aortic root tissue around it. It also requires re-implantation of the coronary arteries. That's kind of your topic Tuesday. And I think that's a great way to sum up that root area, that particular zone. And this is another reason why I think we've been so excited that the aorta was granted to be called its own organ. And it's because each of these zones are just so critical and so important, and they have so many different components. So by the time you get to zone 2, which is, I believe, the arch, picturing it, I think it's 2, pretty confident it's 2, or it could possibly be 3, but I'm pretty confident it could be 2, but it could be 3, but it's the arch. That's going to have different components. You've got 3 main vessels coming off of there, and diagnosis, monitoring, treatment, it's going to be different than what's going to happen in the root. Right? So a dissection in that area, the response might be different than zone 4, which is now coming around into the descending, or zone 5 or 6 as we head down towards the abdominal area. So these zones have different ways of monitoring. If you develop aneurysms, the size capacity could be larger in certain areas, and the way that you treat them and even recovery could be different. So I don't know about you. I've just become an aortic nerd, and I just am very fascinated by one vessel that's become an organ that has all these different zones that mean so many different things and could switch hands at a certain point and involve vascular surgery. To me, it's just fascinating, and it's really helped me not be as frightened. Now that I know so much more, I'm just more intrigued by this vessel, this organ that's in my body. So I hope you find all of this interesting too, and maybe share it with a loved one or a friend or family member, because it might help them better understand if you have or had aortic root involvement and had or might be having a Bentall procedure. It's your topic Tuesday. Wish I could say cheers, but it's only iced tea.
Do
It's
do
not very
do.
exciting.
You're on fire today.
I
Good job.
thank you. I get excited. I get really
Yeah,
jazzed
when you're
about
nerding it
education.
up. Mm-hmm.
So excited. We'll see if I have the same excitement when I start reading the patient guide.
I have been thinking about that. I can't wait.
I'm
We have
ready.
to pick a time to do it.
I'd like you to consider the live reading in Aortic Disease Awareness Month. I don't think you'll agree
I
to
like
that. I
it.
think you're going to want to. Oh, you do?
No, I like it.
Joy. That's great. I love that too. I love that for both of us. All right. We have decided to kick back up the Genetics 101 that was created by Ryan Rodimer, our genetics educator, who actually leads and spearheads the VEDS movement, which is the Vascular Ehlers-Danlos Syndrome page and organization. So you should check that out. We talked about this like two years ago or so, and now we brought it back, and we're going to go through all of the major genetic conditions that you hear about. I'm not going to go through all the other 36 or 35, because I believe there's 38 right now, aortopathy genes, and all of their letters and numbers and decimal points. Too confusing. It's just too much. So we're going to go through the biggies and maybe a couple others. And because what happens is when you think about genetic conditions, we often think about Marfan syndrome. That's the one that comes to mind, but that's far from being the only one. We're going to talk about Loeys-Dietz syndrome. It is a lesser known but very critically important disorder that can lead to aggressive aortic disease, and often without the same obvious signs that you would see physically in a patient with Marfan syndrome. So it's a lot less noticeable, but it could be very critical. Okay, so we need to really learn about this. So in this installment of the Genetics 101 series, we're going to explore the complexities of Loeys-Dietz syndrome, or LDS, and its subtle clues, its serious risks, what families need to know about diagnosis, treatment, and the inherited risk. So whether you're a survivor, a caregiver, or simply learning about connective tissue disorders, this article might really be vital for your health or just for someone that you love. Okay, let's get into this. In Ryan's previous post, So last week, we kind of talked about the world of Marfan syndrome. So if you get a chance, you should go back and check that out. It might help with moving forward into LDS. And while we know that Marfan syndrome is probably the most well-known genetic syndrome affecting a body's connective tissue, talking about LDS, we're still going to be emphasizing the importance of spreading awareness and understanding among not only healthcare providers, but also survivors, families, and caregivers dealing with aortic dissections or suspecting Marfan syndrome in an underlying case. So in this installment of Genetics 101, we're going to learn about Loeys-Dietz syndrome. And as always, Ryan's information, if you want to reach out and ask a question, which I have done many times about my own personal life, it's ryan@myaorticjourney.com. If you got any questions, feel free to reach out to him. And then next week, when we do our week in review, we're going to, well, next week is Memorial Day. We're going to talk about that. The next time that we meet up for week in review, we're going to talk about Ehlers-Danlos syndrome. So there's a vascular and a non-vascular, and it's a pretty important one to learn about as well. But what is Loeys-Dietz syndrome? Okay. Loeys-Dietz syndrome is a rare hereditary connective tissue disorder that affects the aorta and other body systems. And few people are misdiagnosed with LDS like we see in Marfan syndrome, in part because it's so rare and it's something that most doctors are not very familiar with. And also historically, people with LDS, it was a condition that was known for having very significant features like features that are just different to the face and the structure of the skull and major orthopedic differences. So it's not a term that physicians are just throwing around, which is why we don't hear about it so often. There's a lot of specifics in order to be, to be given this diagnosis. But we know that there are some families with LDS that don't have these significant features at all. In fact, they might have very subtle features, or they might not have any at all. It really depends upon the gene and or genetic mutation that's involved. So for this reason, for aortic dissection survivors and their families, understanding LDS is really important, especially when it comes to non-classical or less severe presentations with few related body findings. So let's learn about LDS some more, shed some light on the genetics, symptoms, diagnosis, management, and etc. Loeys-Dietz. It's actually been named after Dr. Bart Loeys and Hal Dietz, who's right here in Baltimore out of Johns Hopkins. They are the researchers who first described the disorder back in 2005. So we are not talking about a disorder that goes way, way back. So remember, Abraham Lincoln had Marfan syndrome, although I don't know that it was diagnosed and called Marfan, but we now know that he had it. So looking back in history, this was officially named and became something we need to be aware of only back like 20 years ago. So, it's pretty soon. LDS affects the body's connective tissues, which actually lead to a variety of problems, including aortic aneurysms and dissections, but also aneurysms and dissections of smaller arteries. These could be arteries that lead into the arms, into the legs. So we're not talking about just major big one like the aorta. When you compare this to Marfan syndrome and other hereditary thoracic diseases, LDS might be somewhat similar to Marfan's, but it's a distinct disorder. Both conditions involve connective tissues and their abnormalities and an increased risk for aortic dissection. So just so you're aware, despite the fact that people with connective tissue disorders only represent 30% of the entire aortic disease population, 70% of us have no clue why this happened. Of those 30%, 50% or more are likely to have an aortic dissection because of having a connective tissue disorder. So those that have CTDs are more likely to have a dissection than the other 70% of us. So that there's no pros. There's no pros in having one or the other. It's all just not pro, okay? But when you have LDS, it can progress a lot more rapidly and often affects individuals with different physical characteristics. So let's talk about the prevalence and the demographic factor. It's a rare disorder. So it's not something you have to worry about. All of you listening don't have to sit there and say, oh my God, I think I have LDS. Its estimate prevalence is 1 in 100,000. So it affects people of all ethnic backgrounds and all genders. This is a non-discriminating disorder, okay? But the genetics of low EDs, there's a lot of genes. There's a lot of genes that are part of the LDS pool, okay? Ready for this? Listen to these letters. This is why we weren't going to go through all of them individually. We're going to lump in them together into things that are more well known. TGFBR1. A lot of letters, right? It's like a zip code. TGFBR2, SMAD2, SMAD3, TGFBR2, TGFB3. This means a lot of letters to me, a lot of consonants, a lot of consonants. These genes, though, they play a role in development and maintenance of connective tissues, particularly in the aorta. Here's the inheritance pattern. So try to follow all this. Okay, this is like starts to get a little out of my pay grade, but I love the way Ryan describes it. So LDS is typically inherited in an autosomal dominant manner, meaning that a person with this syndrome, okay, has a 50% chance of passing it on to each child. Each child has a 50% chance of getting this, okay? Like Marfan syndrome, about 75% or 3/4 of the time, the condition is inherited from an affected parent. The other 25% or quarter of the time, the condition occurs as a result of a new genetic typo in the child. Okay, meaning this person just spontaneously have it. We had Bill, one of our board members, first person in his family, has this a genetic typo basically in him. However, the affected child's, but not for LDS, for Marfan, the affected child's future children still have a 50-50% chance. So if you're somebody who did not inherited this and did not inherit this from someone else and you just spontaneously developed it, your children still have a 50-50 chance of developing LDS as they would with Marfan. It's the same. Genetic testing and counseling options. So genetic testing can help you determine if you have an LDS diagnosis or identify an at-risk family member. Genetic counseling can provide essential information and support to individuals and families that are affected by LDS. Let's get into the symptoms and manifestations. If you have symptoms similar to what we're going to talk about, it does not mean you have this. You have to remember, I have 3 things that are part of Marfan's. I do not have Marfan's. Some people have more characteristics and still are not coming back with a positive genetic test. This is just for learning and educational purposes. This is the type of thing that should help you give you a little edge in acing your healthcare journey, right? When it comes to advocating, communicating, and educating your physician, talking to them about anything you know about your family history and having them ace this journey with you and educate you. So this is a good conversation starter. Nothing to freak out about just yet, right? Classical presentation of LDS. So major body findings would include having an effect on multiple systems. So symptoms could be aortic aneurysms and dissections, but also involving small arteries as well, okay? Arterial, I can't say the word. It's always going to be, I'm on a roll and there's always one word. I can never say this. It's not tortuous, right? Tortuosity. It's that word. It's this one right here. It's getting me. Arterial tortuosity. Twisting. It means twisting. Wow, these big words, these medical professionals, right? It's twisting or curving of arteries. You can have a tortuous artery anywhere or vessel anywhere. It just means twisting. So if you have an arterial twisty vessel, actually, I like the way I explain it. You might have skeletal abnormalities like in your chest. It could be a deformity of your chest, pronounced concave. I would suppose it could go either way. Scoliosis, a lot of joint laxity, which I believe means flexibility. Cranial facial features. So if you had wide spaced eyes, if you have a cleft palate, if you have a bifid uvula, that thing that hangs in the back of your throat that people often call a google. I've heard my father used to call it that all the time. If your uvula looks like it's split in half, that's what that means, a bifid uvula. And I'm only making a face because it just made me remember when I learned about the epiglottis. And it's not a thing you want to look up, okay? It's just not. And we all have them. It is really, really funky alien looking like thing down the back of your throat. But it just made me think of it because it's in the same area. You might have craniosynostosis. which is the bones in the skull fused together too early, leading to an unusual shape of the skull. You could have some skin abnormalities, pretty translucent skin. You might bruise easily. LDS can also lead to some additional features very similar to Marfan, including tall stature, long fingers and toes, flat feet. And then the non-classical presentations of LDS or milder atypical could be, um, well, they're not really necessarily reviewed here because some people with LDS could have mild or atypical symptoms, which that's what kind of makes it difficult in diagnosing it. It makes it more challenging. They may not exhibit the classical symptoms we talked about before, like the craniofacial or the skeletal, but they're still at risk for aortic dissections. So, the importance of considering LDS in aortic dissection survivors without classical features. Given the potential for non-classical presentation, it's really vital for aortic dissection survivors and their families to consider the possibility of LDS in their risk assessment if they don't exhibit all of the typical features. Meaning it's not your job to make that decision that you could possibly have this. It's just maybe something you want to think about that might move you closer towards wanting to have a genetic test, right? The genes that cause classical and non-classical forms of LDS should be on aortic genetic testing panel. So when you have them, they're part of that 38 aortopathy panel. You don't get to ask. I've had many people say, what panels should I ask for? That's not how genetic testing works. They put in for aortopathy panels, it's already all included. So you don't have to worry about any of that. That's not your wheelhouse, right? Your job is to come prepared to a meeting with your family medical history, including gum disease, whatever it is, right? Don't make the decision what you think is relevant. Come to the table with known medical issues. You don't get to determine if they're severe or not. Bring everything you know to your meeting with your genetic counselor, and they will map it out. It's like a flow chart, and they can figure out how things fall in line and they read it differently. It's like reading an EKG. They read these. This is what they do, and they can study it against how your DNA comes back and how your genes come back. When it comes to imaging and monitoring for people that have aortic abnormalities, echocardiogram, CT scan, MRIs, they can all help detect aortic abnormalities and monitor the progression of LDS. Regular imaging, as with all of us, is going to be essential when it comes to intervention and preventing any complications. So, one of the key takeaways here that we talk about in Think Aorta is whether you have genetic testing and you find out that you have a CTD, a connective tissue disorder, or you don't have testing or you find out you don't have anything today. Regular monitoring is so important for all of us, for all of us. And having your children or siblings having their own regular monitoring is also important unless they've had a genetic test that has definitively ruled out. Definitively. Not this, you don't have anything today. I personally look at we're not showing anything as see in 6 years when more have been discovered. I'll come back and have my testing done in 6 years. Until then, my son will have a test. I will have 6 tests in 6 years. He might have one, right? Because he's young and not displaying anything at this point in time, whereas I am, and I've already had an issue. So, regular monitoring, that's the key. Due to the complex nature of LDS, however, you really do, like with Marfan syndrome, need to look into having a multidisciplinary care team. And that would include not only a cardiologist, not only a geneticist, but other specialists that might be, it could be ophthalmology, it could be orthopedics, but you need other specialists that can help with diagnosing, monitoring, and treatment plans. Management and treatment of LDS. So, lifestyle modifications for people with LDS. They have to adopt certain modifications for sure to avoid risk of complication. And that would be avoiding high intense sports. That's the same thing that was listed for somebody with Marfan syndrome, or activities that can increase your blood pressure or increase the chance of trauma to the chest. You want to maintain a heart healthy diet. Does everybody that doesn't know they have a CTD, right? Everybody should be doing that, and refrain from smoking or using tobacco products. And that goes across the board for everyone. There are medications you might be told to take, like a beta blocker or an angiotensin receptor blocker or an ARB. Um, and that's because they can help lower your blood pressure. And that's important. And that might also possibly reduce the risk of an aortic dissection in patients that have LDS. When it comes to surgical intervention, surgery might be necessary to repair or replace an enlarged section of the aorta or to fix other issues like an orthopedic issue. Okay, the decision to perform surgery kind of depends on factors like the size of the aneurysm, the rate of growth, the patient's overall health. And individuals with LDS do have an increased risk of dissection at smaller aneurysm diameters. So every time the community is talking about, oh, but you're not at 5 centimeters yet, you don't know if that person has Loeys-Dietz syndrome or Marfan. They may decide surgery is more appropriate at 4.5 centimeters. So, which is why we don't want to give medical advice on those pages. You want to just talk about your own experiences. So, understand that people with Marfans and LDS might have a different threshold in which time they're going to have to then have surgery. So, proper diagnosis super important as it relates to the timing of surgery as compared to other genetic causes of aortic aneurysms and dissection. I've mentioned this so many times because it's so important. Regular monitoring and follow up care is critical for individuals with LDS to ensure timely interventions and appropriate adjustments to their treatment plans. But, living with LDS, it's going to have its own emotional and psychological challenges. And the reason it can be challenging both physically and emotionally is because I think it makes sense that coming with the diagnosis of LDS, a patient might feel anxious, they might become depressed, they could feel a little isolated. Mental health support is crucial for people that have had a diagnosis of LDS. It can really help patients, can really help family members cope with those types of challenges. And support groups, whether it's with Aortic Hope or you go into the Marfan Foundation or the Loeys-Dietz Foundation and look for direct support groups, it's really going to be very helpful to talk with like-minded people. It's going to help you through the challenges. It could be a patient advocacy organization, online forums like Facebook. Really, there's so many different offerings that I'm sure patients can be able to find their groove, really what's going to make them feel most supported. Advocacy and awareness efforts. They're, talking about LDS, what we're doing here right now, advocating for better resources really can help improve the lives of those people that have LDS, participating in an awareness event, in fundraising, in sharing your personal experiences. It really can make a difference. And so, in conclusion, understanding Loeys-Dietz syndrome and other connective tissue disorders are really vital for proper diagnosis, which we've talked about, and management of aortic disease. And by raising awareness and staying informed, we can really empower ourselves and our loved ones to help make us make the best decisions for our health. And as we continue to explore various genetic conditions related to aortic disease, don't forget to keep an eye out for our next installment, which is going to be about Ehlers-Danlos syndrome. And again, if you have any questions or concerns, you can always write info@aortichope.org or write Ryan directly at ryan@myaorticjourney.org. And, let's just keep continuing to learn and support one another on this journey with the help of Ryan and the help of Aortic Hope.
And
Whew.
once again, that's Ryan at myaorticjourney.com. You said .org. It's okay. Katie shares with us, my son inherited the AHTV from me.
Yeah.
My daughter tested negative for it. Get tested. They thought he had LDS or Marfan's, but they found out what he really has.
Yeah. AHTV is even newer, I think, than LDS. I think that was discovered or given its name. It could have been like probably between 10, maybe 10 years ago, maybe it's been recent. And I know Dr. Diana Milowitz, I believe she had a direct hand in discovering ACTA2. And I think these are probably all mutations off of each other. But you're right, Katie, it is very important to consider being genetically tested. As the parent I have, and I am always, I am not going to have my son because they don't know what to look for because I have nothing. But as soon as I have something, you better believe it, they're going to be looking for that specifically in my son. And everybody does things differently. But until then, he's treated as if he does have something. Now, that is something I definitely agree with. There's a lot of people, personal choice, they don't want to do the genetic testing. That's fine as long as you treat yourself and you treat your children and your siblings. Consider having that proper continuous monitoring in case there's a diagnosis, so we can intervene early.
Mm-hmm.
It's all important stuff.
And Dean has joined the chat.
Hey, Dean. All these people from sunny places. It's pretty sunny here. All right, we are moving on to Feel Good Friday. I'm going to disagree with this. I'm going to disagree with this Friday. The question in the graphic here says, "Do you enjoy planting flowers and gardening?" Something special about getting your hands in the dirt and adding a little color to the world, one bloom at a time. No, I am just not that kind. I don't know. I like wearing cute gloves. I liked sitting on a cute little mat. I had to plant this weekend at my other house. So I had because it's a major mosquito issue. It's a major mosquito thing going on right now. So I bought a ton of citronella and some mint. Actually, it's chocolate mint. It smells so divine. And I went to this garden. Like, how much soil do I get? Like, what kind of soil? It was good. What kind of pot? And this lady's looking at me. She's got like dirt all over her. She's, dirt under her nails. And I'm just like, I don't want to touch it. So I'm one of those people, totally way too foo-foo. But I did it. I laid down the garbage bag and I put the soil in with my scooper. And, I probably sit there like this. Okay, where's the plant? Right. And I knew to break up the roots. I remembered my husband. He was in landscaping, he was younger for many, many years. And I planted it. And I put a globe in it, like with water, because I'm not there every single day. And it's planted. I don't know if it's going to work, but I'm very excited that I did it. And I'm so excited that I don't have to plant anything again. This doesn't work. I'm out. I will bring my husband lemonade and say, good job planting. But I do not touch dirt. I do not like spiders. Oh, speaking of spiders, let's digress. Everybody that knows me knows how much I hate spiders. Okay, just hate. I came home the other night with my mom, went into the garage, and I see across the garage, I see this thing on the wall. I was like, please let that be a stink bug, right? And I get closer because I don't have my glasses on. And it is, okay, so it's my palm. It's probably like this big. Okay, really like this big spider. And it's just doing its thing, just crawling. Now I have to assess the situation because there is a chance it could get in somehow into the door. Those suckers can get really flat and they go right underneath the door. So we can't let that happen. I don't have any like specific spider spray. I mean, Google, I know, sorry to all of you that love saving animals. I love you all for loving that. But when you have such a deep-seated fear, you must take them out of your dwelling. And if my husband were there, he would have scooped him up with his hand and said, "Oh, little spider, come into the little Tupperware and I will set you free." But when it's me, that they meet a demise. I'm sorry, I feel so embarrassed saying it. So I took some Windex because I read that Windex would kill me. It's horrible. I know I'm horrible. I'm so sorry. And I sprayed it with Windex until it fell on the ground. And I grabbed my flip flop and I knew I had one shot. And I found that flip flop. And with my other flip flop, I hammered the heck out of my first flip flop. And I waited because this thing was so big it could have moved my flip flop. And then I quickly pulled the flip flop away. And I saved myself and my mother. My mother took off. She said, nope. And she was out way in her bedroom. She's like, sorry, I couldn't help you. If something happened to you, I had to save myself. So she was gone. And I was in there screaming bloody murder for no reason. It's not like the thing was going to come after me. And I did feel guilty. So please love me anyway. I did feel a sense of guilt. I did. Um, you know, but it had to be done. I could not have had that get into the house. So I don't plant because there could be worms and there could be bugs. And I love all of you guys that plant and I'm mesmerized. And when I was younger, we planted cantaloupe, cucumbers, tomatoes, all the typical things that parents want to plant with their kids because it's fun. But then we have so much we can't eat it all. And we did. We had 2 garden beds in our backyard. And I did not plant then either. No, I'm just not I wouldn't even know. Like, I don't know. I don't know anything. I don't know how much soil. I just did it till I thought it looked good. And then I poured water in it. And I was like, there's my plant. So, according to this post, whether you're planting a whole garden, filling a window box, whatever it is, taking a potting, like just potting a single sunflower. I'm sorry. I got a cutting from a peony, which I love peonies. And I just snipped it and put it in a vase with water. That's my idea of planting. Okay. Um, Look, the reality is taking time to connect to nature is actually good for you. I do take away the thoughts of spiders. I do like planting my bare feet in grass for a little bit. I have to avoid mushrooms and goose poop, but I do like it for a little bit. I'm not a nature person. I'm just not. I'm not nature. Like if I'm going to take a hike down a path or a trail, I need someone to go ahead of time with a broom and get all the spider webs gone. Because I literally will just walk with a gigantic stick trying to make sure I don't walk into them. And I'm going to tell you why I disagree with this. Let me tell you about the time I, I was a bus counselor when I went to summer camp. And I was a counselor as well for a cheerleading camp or whatever. And so I'm on the bus and I'm so excited because, I've got my clipboard. And that's what I worked for. For years of being a camper, I wanted to have the clipboard to be the bus counselor so I could hear the clipboard sound. That's what I wanted to do. Not realizing it meant going on and off the bus every time to get the kid and walk him on the bus. So we pull up to this house, hitting the horn, nobody's coming outside. I'm like, well, this is the address. It's like the first day of camping. I got a bus load. And after this, we're going to go right to the camp. And I get out, and just walk right up to the front door to go to knock. And I have walked into the vestibule, which was covered from top to bottom in spider web. And I walked through the spider web, covered head to toe. Want to talk about dancing like some kind of crazy person dance? I am very lucky I kept some sense and didn't just rip off all my clothes because I lost my mind. It was in my hair. I lost my mind and I didn't care about the kid. I was like, get on the bus, we're leaving. And I can't, I hate it so much. Hate it. I'm just not a nature person. I'm not. I like looking at the beach, but I don't like going in because I know there's sharks. I like looking at flowers, but I don't want to walk by them because there's bugs and there's dirt. But do you like planting? Because I know Nikki, who wrote the post, she likes planting, she likes gardening. And if you do, what's your favorite plant? What's your favorite flower? Me, give me some succulents. I can't kill them and I don't have to plant them and there's not going to be bugs. So I don't know. But we hope that you soaked up some sunshine. We hope you got a little bit of nature in. We hope that you connect in whatever makes you happy. For me, it's not planting. I'm just telling you like it is. I'm being truthful. Mm. I'm on fire,
I'm
like
allergic.
Pitbull says.
I don't go out there.
See? Well, there you go. That's good.
I don't appreciate camping at all. I don't understand why anybody would want to do something like this. Like, what is the exact thing that you get? Like, how is that relaxing? Being exposed to the elements and
Yeah.
bears,
Yeah.
right? And
And
you're sleeping on the
mosquitoes.
ground. What are
Why?
we doing?
No air conditioning? Are
No
we
air
all insane?
conditioning. This doesn't make any sense to me at all.
No.
And
Eating beans and hot dog bits in
and
a pot?
and I have friends that are like Eagle Scouts. They can exist with a hammock
Oh,
and two trees for
no.
weeks at a time, and I salute them.
Mm-mm.
I salute them. If
No.
if things go off the deep end and we don't have an internet anymore, my utility goes to the ground
Yeah.
immediately.
Yeah. I
Immediately.
don't I'm not paying money to go set up. I did when I was a camp counselor and camper, we did go camping like every Friday to someplace else. I hated it. It's hot. You just sleeping in the sleeping bag on the ground and no AC and bug spray everywhere. And then they got to light a fire. And then I don't know what I was eating. It's miserable. Glamping. I need AC. I need a nice mattress. I need a fan. If you can give me that, I don't really care what the dwelling is as long as there's no snakes, there's no mosquitoes, there's no chances of bears or other interactions with any animal life. And when I go to the bathroom, I want a spa like event. I want a nice shower.
I was gonna
So
call
that's
you
my
out
chance.
on the outdoor shower immediately.
I am not an outdoor shower person.
That's what I'm
Too
saying,
exposed. No.
right? Because that's where the
N-
bathroom would
n-
be, presumably,
No. No. It's where all the daddy long legs live in the
right?
spider. I mean, in the
Molly
bathroom.
Molly
Never.
shares with us. I planted a raised garden and it is bursting with tomato, onion, pepper, jalapenos, radish, cilantro, rosemary, basil, lemon tree, and edible marigolds. I love my garden. I think that's 5 exclamation points. And Christina puts a
Yay.
little smiley face with the heart eyes there. Molly.
I'm so proud of you, Molly. That's so much wonderful stuff to
Famously,
plans.
Molly
Yeah,
couldn't grow anything, and she has been directed. Well done. Way to follow
good for you.
instructions, Molly.
Good for you. Yay. You can make me spaghetti sauce when I come see you another time with your tomatoes and your onion. Yeah. I might pick it if you tell me, but I won't even know if I'm picking it and it's ripe. I don't even know how to do that. And I'm not upset about it, but I am happy for you. Oh, I just snorted. See, that's how much I hate it. But this is what I could use your help with, Josh. Let's talk about the Survivor series that went live this past Saturday night that I was not around to hear because I'm clearly very busy. But it's our old friend Scott Benton. He's been part of Aortic Hope for years. He's been part of us. Love Scott. I hope it was great. If you didn't get a chance to see it, you can go right underneath of our programs and just connect right into Survivor series right there. Bink, and his should come up, and you can check out his video. And you know what? If it inspires you and you haven't been part of this series, we want you to be a shining star in someone's life. You can do what Scott did and go live and take questions from everybody. You can pre-record or you can send in something in writing. Doesn't matter. We want to know about your experience with aortic disease, anything, aneurysm diagnosis, aortic, valve issues, dissection, caregiver perspective. We just anything. Just want to know. We want more education. We want more experiences. Tell us a little bit about Scott. Josh.
Well, Scott is a giant in his family. And so when we were talking about the genetics of earlier, that
Yeah.
was a pretty good portion of his story. His parents, I think, are like average size. His brother's average size. Grandparents average size, and he's like
Yeah.
6'4".
Yeah.
He's a mountain of a man.
Right.
And in his youth, he did the powerlifting, and he was also
Hmm.
still doing that when his aortic dissection took place.
Yeah.
But he was also a police officer and a SWAT team member.
Hmm.
And so he took that giant frame of his and he went and protected the people as a civil servant. And we salute him for that.
Yeah.
Thank you.
Yes. Yep.
Um, Crazily in the story, he explains how after he gets back to the house, he he kind of passes out in the shower.
Mm.
And his wife was with him, and she was also very into fitness, so she was able to leverage him back down. But like that is a absolutely scary situation to be in post surgery.
Mm-hmm.
So he's got great stories about the stuff that he had to take care of, and he talked about having a collective knowledge base from fitness between him and his wife that he kind of skipped cardiac rehab. He was like, I don't think we needed it.
Right.
I was like,
Okay.
yeah, I hear you. He goes, he's very deep into his faith, and he puts a lot of his faith into how he pulled through.
Mm-hmm.
And we're glad to have him. He tells a great story. On a side note, his teaser is the best performing teaser we've had. It was
Oh,
it
really?
was great.
Great.
Yeah, I was so he kind of screws up 6 p.m. Central with 6 p.m. 7 p.m. Eastern
Mm-hmm.
or what have you, right? And I kept the blooper. I was gonna cut it, and then I was like, nah, I don't want to cut it. So what I did was I put little emojis in there, and so the emoji is reacting to him trying to figure out
Okay.
what time it is.
I'm gonna have to look at that. If I had time, I'd be playing it now for
Yeah.
everybody, but I'm absolutely gonna go look at
So
that. That's
no, it's
great.
great. And so, but again, he does a great job telling his story. Christina says it was a great Survivor story.
Oh,
Dean
good.
says
Glad you
you've
liked it.
done really well, Molly. Beautiful and amazing garden.
Yay. I want to see a picture of Molly's garden.
I'm
I will
surprised
do
she doesn't
that.
have that on Facebook.
I know, she should. Massive accomplishment. All right. Moving on. Hey, we had a great Friday, you guys. The seatbelt covers, they're just flying out of the drawer right now. I've actually have to go place another order. So, and of course, I don't have one easily available right here, right now, but I will just pull one out just to show. I got one. So we've got these new seatbelt covers. What we did is we used to have so many different sayings when we first did this. We had aortic dissection, thoracic aortic aneurysm, abdominal aortic aneurysm, pacemaker, all this stuff. And after discussing this with EMTs and with surgeons and with ED hospital directors, aneurysms, dissections all fall underneath of aortic disease. So if you're in a car accident, for instance, and your airbag goes off, you should always have a CT scan, regardless if you've had a dissection or you have an aneurysm. This CT scan should be happening. If you end up in any kind of distress, differentiating that for an EMS officer truly won't make that much of a difference on your belt as much as what you put on the inside card. So this is your belt, right? We have these in black and red. This is medic alert, which is perfect for people who have type 2 diabetes, or you maybe have you are at risk for stroke, or you're on blood thinners, something else that might not be related to aortic disease, or you can choose just to say aortic disease. Comes in black or red. It goes on by Velcroing it right around your seatbelt. As a matter of fact, you can put it around your dog leash. You can put it around your backpack sleeve. You can put it on your bike, right? On one of the, what's it called? Like up on the bar, on the bike, wherever you think you're going to be out and about most active. And inside there is a little sleeve that has a card that you can put allergies, you can put current medications, doctor's name and number. In case of emergency, you can put your ice contact there. And that's it. It's simple. It's cotton. It's washable. It's very comfortable in the belt, very flexible. Get one for if you are the driver and you got more than one car, put it in more than one car. But if you need to move it, again, it's very easy. Just Velcro on and off. And they come with $18 donation that includes shipping. Goes right out. If you're international, $23 donation. So take advantage of this, right? If you want to get some swag, this is the time to do so. This is a great item. When you click on the Hope Swag tab on this order form that you fill out, you're also going to see an opportunity to garner one of our decals with another $5 donation, and our thick, heavy magnets with a $10 donation. So it's all there on one page for you to place your order. And that was our swag. That was our swag post. All right. Let's talk about our events page. Changed up a little bit. A lot easier for you to see all of our support groups listed
You
right
have to
here.
refresh that page.
I'm going to refresh it right now. Here it is. It's coming to you refreshed. Right. So support groups, very easy because they don't change. They're all right here. If you want to click on one of these titles, you'll have an opportunity to register. Register once, you will get an email with a link to join the support group that you've signed up for. Okay. The reason they're different is because we have a Canadian one separate. We have one in Spanish. We have one that's open to survivors and caregivers, and one that's for caregivers only. This is very, very different than the WISE group, which is Women Inspiring Support and Empowerment. Okay, so you have your caregiver connection, which is really less. I'm not going to say less. It's support and connecting. It's a group for caregivers to have an opportunity to just connect with each other, whatever that connection looks like. The support group for survivors and caregivers is providing support. All right, we have a lot of new people in the community, a lot of people who have been in the community for a while. They may not need it, but they want to give some support by sharing their stories. That's kind of like the difference between the two right there. So let's take a look at today. We've got that live event coming up for Mental Health Awareness Month, which is now month of May, with Amy Wagner. So if you've wanted to learn a little bit about EMDR, eye movement desensitization and reprocessing, which is a superb way of helping you combat the symptoms of PTSD, check this out tonight. Learn about other ways that you can work on some mental health issues that you might have specifically related to aortic disease or otherwise. Then we've got tomorrow night, 7 p.m. Eastern, we have our interview with Dr. Jita Hajar. It's going to be myself and mainly Velda McKenzie interviewing her because she's out of Canada and she spearheads the Lowy Dietz Foundation. That does not mean that she only treats people with Lowy Dietz. Okay, that's not the case at all. Her bio is in this in the event page that's located on Facebook, but I can't wait for you to meet her. I'm so excited to interview her. I've talked with her a bunch of times, never had a chance to go live with her like this. And then Wednesday, we're going to take your mind off of aortic disease. Time to paint some rocks, everybody. So I am going out later today. I've got a lot to do after this, and I'm going to be looking for some soft, smooth rocks. I know they sell them at Michael's. They may have some at the dollar store. They may have some just on the street corner. I might just grab two. And we're going to paint rocks. And then the fun of it is when you leave them someplace in public and let other people find them. I think that's a lot of fun. I love finding them myself, but then I'm kind of a dork. Then we have our Therapeutic Thursday. We have a live Survivor series happening this Saturday on the 24th. Michael Pace. So Michael is a dissection survivor, that recently did a Spartan race. He raised money for Aortic Hope. We were so thrilled and honored to be the recipient of what he raised with his team. And he's going to talk to you about his story and talk to you a little bit about what he just recently accomplished. I find it all very fascinating. It's amazing. And then typically on Sundays at 12:30, we have our Qigong series led by a survivor and community member. The WISE meeting is canceled for May because it falls on Memorial Day. So we're not going to be meeting because people will be having hamburgers and hot dogs that night. I just guess. So that is pretty much what we've got going on in addition to our Ask a Doctor event, which is happening on the 27th. So with our Ask a Doctor on Facebook, if you're on Facebook at 6:30 on the button, you will see a pinned post with Dr. Tyler Wallen's face. This face right here. It's going up on the top of our Aortic Hope Facebook page. And when that goes live at 6:30 p.m. Eastern, that means you can start putting in questions into the comment section of that post. Okay. Dr. Wallen, when he comes on, hopefully right at 6:30 p.m., barring any kind of emergencies, he will be answering your questions to the best of his ability. And then I will be with Terry Cook on our right here on YouTube, reading these questions, relaying these questions, and relaying the answers. In addition, all of you can be on YouTube asking your questions to me and to Terry. We will then be typing that into Facebook and relaying the messages that we read there. So it's kind of a simulcast. If you want to remain anonymous, in that post is a link to ask your questions anonymously, and we will ask them for you, and we will give you those answers. So that is happening on the 27th at 6:30 p.m. Probably lasts about an hour and a half, 2 hours. Only lasts for an hour for us here on YouTube, and then we have to be done. So that is what's happening. That is what's coming up, and that's all I got. That's all I got, and I got a lot I gotta go do. So yeah,
I will leave
excited
you
to be
with
back.
this.
Yes.
Dean says, I love Italian Romano green beans that climb wooden poles.
So they
That's
vine
why. That's
up.
how I took it too. Yeah.
Yeah, they vine up. That's cool.
That's our internet
Yeah.
talk for the day.
Okay, that's a great way to end. All right, everybody, don't forget to click like, click subscribe, click the bell. Please share. Other people will find some of this information very educational, and they're going to get a lot out of it regarding aortic disease. And thank you to Velda, Christina, Dean, Katie, Molly, and everybody else for tuning in. And I don't know, Josh. I don't know about next Monday, Memorial Day. I'm not sure that I'm in town on Memorial Day. We may have to postpone to Tuesday. Yeah, we have to talk about this or our last double of this year, I believe, and to hit it for the next week. So I might be missing you guys on Memorial Day, but I'll be seeing you guys here later tonight at 7:30 for our live event. Have a wonderful rest of your week. We'll talk soon. Take care.